So, in terms of interoperability, at a GP level in Greenwich, we have 46 practices, and most of us use Vision, and there's 4 that use EMIS, but those are the 4 big practices. One of the problems that patients have, they pitch up at A&E because they can't see their GP, and they can't get an appointment. So we were looking at working in syndicates. So we were looking at solutions to allow collaborative working amongst sort of syndicates, which are based on a geographical group. So people weren't really keen on switching to one system or the other, so we got the providers together to work on a way that EMIS and Vision could work together, and they've developed something called the Healthcare Gateway. So that is in process that will allow collaborative working and hopefully reduce patients going to A&E and urgent care. In terms of virtual patient record work, we're looking at a software called Orion. And so what that does is that amalgamates notes from primary care, mental health, community clinics, social services, sort of everything, and imports it into like a virtual sort of cloud. Currently data that's put onto the VPR virtual patient record is not pushed onto the GP notes, but they're looking at solutions, for example, an email update to practices if something about their patient has been put on, so that can be pulled sort of, manually onto Vision or EMIS. What else have we done? In September last year, we set up a pilot called Elton Test and Learn at a sort of big centre called Sherrod Road, which basically was done in order to try and reduce admissions for high-risk patients. So GPs on the pilot would identify these patients mostly using software like Q Admission or MSDI software. And based on a RAG rating, if patients had multiple long-term conditions, they were referred into this. So consent would be got from the patient about discussion of their case amongst GPs, community clinicians and social care providers, and suggestions would be made on how to reduce hospital admissions and how to sort of better give them a holistic, sort of well-rounded care, so they wouldn't be pushing up pain. The challenges with that, initially there was a lot of challenges from GPs. This is more work for us, more meetings to go to, it's not really going to make a difference. But now, 6 months down the line, soft intelligence is that actually they're really well engaged, they're making more referrals, more appropriate referrals, and their high-risk patients are getting better care. The way forward is, I think we're pretty much set with the software, the Orion software, to create a digital patient record. And I think that's the direction we're going.
Well, at the moment we haven't purchased anything, but we're looking at some piece of software that will bring all of that data into the cloud and then enable clinicians to access it. And obviously we also considered some kind of information governance issues, and for us I think what we want is some sort of a patient consent at the beginning, so it solves it all. So if you want to do integrated care with us, you need to tick the box. If not, you're not ticking the box, and I'm not sure we can offer it.
So consent solution.
Yeah. Actually what we were told is that they're going to use some sort of a technology that can be easily linked up with other places. So I'm not sure if it's called open source or whatever, but what they were saying is that the script or codes behind it can be easily linked up with something else. So if, let's say, King's College or some other hospital wants to chip in and add their bit to it, or actually extract data from Orion, they're quite open to